The carnivore diet is sustainable. I think that's the best way to describe it. It's not a calorie restrictive diet. So it's a lifestyle. It's the proper way of eating. It's actually not a diet. It's a lifestyle. It's a way of eating. You know, if you think of our ancestors, how would they have hunted and farmed goats and cattle and animals of all sorts? You know, this is the way that we lived. You know, if you think of modern agriculture and you know, fridges and all those things, that the modern technologies that we have, and the chemicals, insecticide, pesticides, and agricultural practices with big farming equipment, those things did not exist hundreds of years ago. So what I'm saying is that this is a way of eating. Dr. Kendi Barry say this is the proper human diet. So I always say, if you have an animal on the farm and you see that animal does not look so well, and you check and you see that animal is not eating the species appropriate diet, for, you know, if you will tell your worker, no man, go give that animal the correct food. And this is what we say, is we believe that the carnivore diet is how we eat. So it's not calorie restrictive in nature. So we don't calorie restrict. You eat as much as you want. You eat until you're satiated. And you'll see that the carnivore diet keeps you satiated. It keeps you full. With carbohydrates, on the other hand, you quickly run out of energy because you burn glucose. Now we burn ketones, and that's the difference. There are some people that don't do the carnivore diet for long term. There are people that only want to sort out certain health problems, and they don't need to do the carnivore diet forever. But many people that do the carnivore diet do it for a long term. I know people that does it for more than 12 years, and it's because you feel so good. So it's not like it's a punishment to do it. Where other diets, it's almost like a punishment. You know, it's a calorie restrictive. You cannot do it forever. After 3 weeks, you cannot. You have to eat. On other diets, on the carnivore diet, you're satiated. There's no problem. You eat as fatty as you want, but you should definitely do it for more than 3 weeks, because otherwise it takes about 18 days to definitely say you should definitely do the carnivore diet longer than 2 months. Don't do it shorter than that, because the adaptation phase is about 18 days. And remember, you depend on how ill you are. Many people don't know they are ill, and how inflamed you are. So as you progress with your diet, there's certain things that will you will become better in certain ways that is not even noticeable for the observing eye. For instance, your testosterone levels, your hormone levels will become better. It's not something that you can see, but your insulin resistance may start to go away after a few weeks, after a month or so. Your hypertension might slowly be going down. And I had people that, for instance, did not immediately lose a lot of weight, but because they were inflamed, the inflammation started to go away. So your body knows what you need. In other words, your goal might be to lose, or somebody's goal might be to lose X number of kilos, but it's not your body's goal. Your body does not understand kilos. Your body understands it wants to feel better. It wants the optimal hormonal situation. It wants the optimal blood circulation situation, cardio situation, insulin situation, blood glucose situation, all those kinds of things. So what I say is, look at the carnivore diet on a long-term perspective, not on a short-term perspective. It's not a calorie restrictive type of diet, a quick fix in 2 weeks situation. Although you can reverse your type 2 diabetes very quickly, but then yet, even if somebody reversed their high glucose levels, they might still be overweight, for instance, or they might still have hypertension. Yeah, but consider the carnivore diet. Check out the frequently asked question playlist on my YouTube channel, as well as the testimonial playlist. Yeah, and thank you for the good question. Also, regarding how patient you should be with your progress, you know, I've got videos on my frequently asked question playlist about weight loss stall, and your question actually ties very much in with that question that I already answered, but I'll just touch on it. And like I said earlier in this video, your body might be healing. So be patient with your progress, be patient with your goal. Just know that if you eat in the proper human diet way, your body will heal itself. It does have the capability to heal itself, but you have to be patient and you have to be committed. I always say if you get the mind right, if you get the head right, then you can do it. But some people, they don't want it so badly. I often found myself where I want their health more for them than they want it for themselves. So they are not so very much motivated to stick to the program. One of my friends, Norman Nell, said it very well. He knew that he wouldn't make it if he did not change his way of eating. You know, he will die. He would have died. This is how sick he was, and of course he reversed his type 2 diabetes. He lost 158 kilos. You know, so check out his testimonial video on my playlist. L15 or L14, I can't remember, on my YouTube channel playlist.